If you live and work in Myanmar, then you're very lucky. It's a beautiful country. But it's very important to have the right health insurance. Pacific Prime is the world's largest distributor of international private medical insurance to individuals and to SMEs. In 2013, we were awarded by Bupa International and IHI Denmark their Top Global Distributor Award. But we don't just work for Bupa and IHI. In fact, Pacific Prime is a leading global distributor for virtually every international private medical insurance company. So how can we help you? Well, what we'd like to do is maybe give you some advice if you're looking for health insurance. The process we would normally go through is to spend some time talking to you to understand your needs. The point being that health insurance is actually a very complex product. It's made typically today by insurers in a modular form. So things that we would consider when we talk to you is to help you understand and identify which parts of the modules or which parts of the plan are important to you. So I'll give you some examples. An inpatient component going into hospital. Outpatient component would be things like drugs, medication, GP visits. You then have well-being, optical, dental, maternity, so if you're thinking of starting a family. Evacuation and repatriation. If you're living and working in Myanmar, then evacuation could be very important, because in the event of a serious medical issue, you most likely will be evacuated to perhaps Bangkok or maybe Hong Kong or Singapore or perhaps to the west towards Europe. Beyond those aspects, there are things like chronic conditions. Are they covered in full or not? Things like pre-existing medical conditions, will they be covered? Things like deductibles and excesses, a good way to control the costs. Direct billing facilities in the hospitals. Lifetime renewability, does it have it or does it not? Geographical zones of cover, so are you just covered in Myanmar or outside of Myanmar? So as you can see, as we start to break the plan down into the different aspects of cover or the different modules, then most people don't actually really understand those aspects, and our job is to help you understand them, to identify what's important to you, and then we can go away and start to review the market. So once we've understood your needs and what's important, we can then go away and start looking at different insurers. We work with all of the leading international insurers, so Bupa and Aetna and Cigna and Allianz, DKV, AXA, Aviva, the list is very long. But there are also many insurers you've perhaps not heard of, William Russell, Interglobal, IMG, HTH, Integra Global, a la carte. And our job then is to come back to you with these insurers who, perhaps the big brand names you have and the insurers you haven't, and identify a number of insurers and a number of plans which are most suitable for you. We will then go through a review process with you to check which plans are going to be the best. So as you can see, it's a very thorough process. We really help you understand the plans. We can survey and review the entire market, and I'm very confident that anybody who spends 5 minutes talking to us at the start of the process when they're looking for health insurance is much more likely to buy the right health insurance plan for them. So if you're living and working in Myanmar and you're looking for help on health insurance, why don't you come and talk to us?